What I would like to do now, Richard, is show you what is involved in the physiotherapy of the penis. This is a penile pump. So after 6 weeks of surgery, I would like you to get one of these penile pumps. And what you do is you use this every day for about 10 to 15 minutes. You insert the penis in here. You get a good seal. And you do this action. It's a vacuum effect, and what it does, it basically gets venous blood going to inside the penis. And you can hear that it's a vacuum type effect, so blood will go inside the penis and it will engorge the penis. Now you do that every day for about 10 to 15 minutes, and that in itself will get some blood going there. If you want to use that also for intercourse, what you need to do is you apply a ring, which you preload the ring here, and then when you have the erection, you slide the ring down, and you can use that also for intercourse. Now, you should not leave the ring for more than 30 minutes at a time. So that will be part of the penile physiotherapy. The other thing that I would like to do in about 2.5 months' time after the surgery, I would like to also instruct you how to do penile injections. And what we do is you would come here in the rooms with your wife, and we will then instruct you how to do the injections into the penis. And what that will do is it will supply the penis with arterial blood. So you would have an arterial blood. It's a more natural erection. There's arterial blood going to the penis, and it's a healthier way of maintaining the penile health. So a combination of the two will allow us to keep a healthy penis. In terms of the penile injections, if you do them once a week, and that would be sufficient to try and maintain a good healthy penis, and also it will prevent the penis from shrinking because you will have the normal natural erections. Now, if all of this fails, Richard, and in a year's time to 18 months time we are not able to have a normal erection, then we can look at a penile implant. In terms of say a year's time from now, or 9 months from now, if you start getting nocturnal erections, what I would normally do then is we would stop the injections and start you on Cialis or Viagra, whichever it suits better, and depending on the side effects that you're getting from each, we can try both tablets for you, and then hopefully that will get some of the erections happening spontaneously. However, if the Viagra and Cialis fail to achieve the erections in up to 18 months time, then we can look at the penile prosthesis. And what we do with the penile prosthesis, I'll show you here a model of a penile prosthesis. This is a penile prosthetic device. What happens is it's a overnight procedure that you would be in hospital overnight. This is a inflatable, it's a Titan inflatable penile device. This one goes in the scrotum. This is a reservoir that's for the scrotum. This goes inside the penis, and this one goes behind the bladder, or close to the bladder. What happens is when you want to have an erection is you squeeze the reservoir in the scrotum, and you can see here that the erection is happening. So this would be a hydraulic erection using the saline that's inside.
How long is the incision for that?
The incision for that is actually a new technique, minimally invasive technique for this. It's about that big, and it's just about an inch above the shaft of the penis. So, and there's no other incision. So there's no incision in the scrotum, and no incision to put the reservoir in. So all of that goes through the single incision. That's correct. Yes, yes. It's all this technology. So that's what happens there. And then this particular new device from Titan it's a single release. So you press here, and you have to press firmly, and then what happens is this will go down, so the erection will go down, and if you want to assist the erection going down, you can press in the penis and that will go down.
What's the lifespan of this?
The lifespan of this is about 10 to 15 years. So it's a fairly good durable device. But as I said to you before, I mean, we're looking at to try and get you to the normal natural erections from happening. But what I'm saying is that if the erections are not coming back, then there is a possibility to fix that, and this is probably the best outcome, because there's 95% satisfaction rate from patients that have this kind of prosthesis in terms of the erections.